Live. Good morning, good afternoon, good evening, depending on where you're watching this video. This is the voice and the face of Dr. Tolu Olabinton, CEO founder of Living Spring Family Medical Center here in the good city of Mansfield, Texas, where we help our patients live long and well because we believe the quantity of life is just as important as the quality of life. I am very excited today to have on the show with us Dr. Seyi Bolorunduro. He is a cardiologist, multi-specialty or multi-board certified. I'm going to let him introduce himself. And today we'll be talking about how to prevent heart attacks. So that being said, oh, by the way, if you're watching live, hashtag live. If you're watching replay, hashtag replay. All right. So without further ado, I'm going to hand over to you, Dr. Seyi. Please kindly introduce yourself. Who are you and what do you do?
Okay, great. Um, Thanks, Dr. Tolu Olabinton. It was great. It's a pleasure being here. Thanks for the invitation. Um, I am Dr. Seyi Bolorunduro. I'm an interventional cardiologist. I also have a training in master's degree in public health. Um, and So I am an interventional cardiologist. What does that mean? I'm a general cardiologist, first of all, which is a cardiologist that takes care of the heart and the cardiovascular system. And then I did some specialty training in interventional cardiology, which is basically going through small holes we create in the wrist or in the groin to fix the heart. So when you have blockages, you have problems going on in the heart that need a fix, an actual, intervention, we will go through and then fix that. So kind of like a plumber for the heart.
Awesome. And we need good plumbing to make sure the heart is working well. So thank you for what you do. Now, inquiring minds want to know how did you decide on cardiology? We're kind of curious. Like what made you choose cardiology?
Okay. So I've always loved the heart, the way the heart works. In medical school, I started off, trying to figure out what I wanted. I liked a lot of things, but it revolved around the heart. So it was like, well, I like the heart. How do we fix the heart? But the field of interventional cardiology has been evolving. So it wasn't something I knew of initially. So I didn't know exactly how I was gonna, how what I was gonna do or how I was gonna do it. I like the idea of
Mm-hmm.
pinhole surgeries, like actually doing surgeries through a pinhole approach. And as things evolved, I got to know about interventional cardiology. Heart disease is the largest killer of people in the world, at least in the Western world. So realize that, okay, to make a big impact in the world, to make affect lives, to make people live longer, like you said, better quantity and better quality of life,
Right.
being involved in cardiology and then interventional cardiology. When someone has a heart attack, we're the ones that get called in to go in and do the procedure to, fix the heart, restore blood flow to the heart and that kind of stuff. So yeah. So that was
So
why
that's
I fell in love with that field.
That's exciting. And I like that you're so specialized too. And I have Dr. Una who's watching. Hi, Dr. Una. He said, yes, the plumber for the heart. Now, people are wondering, because you hear the word heart attack. Now, in simple terms, Doc, how would you explain to someone what is a heart attack? What is a heart attack?
Okay. So in simple terms, so I would skip you know, the medical description, but I would try to explain it this way. So think of a house as a house, the heart as a house, as a structure.
Okay.
This is how I explain to my patients. I'm like, the heart is a house. Okay,
Okay.
the house has a structure and it has um, plumbing. The pipes give blood flow to the heart. It has electricity. So the electricity also is required to make the heart work. In a heart attack, your pipes get clogged. And when they get
Mm,
clogged, they you don't have blood flow going to an area. When blood does not go through an area, that area does not get blood, does not get oxygen, does not get anything. And then if it's not taken care of soon, that area dies.
mm.
So and depends on how big the heart attack is. It could be a smaller area giving dying, or it could be the big area, a large amount of the heart dying, which could lead to the
Mm.
person dying. So what a heart attack is an impairment or occlusion in the blood flow to the heart.
So a heart attack is a blockage to blood flow in the heart. It depends on how much of a blockage, the level of
Mhm.
effect. Now, the heart is the only organ that pumps, like provides blood for itself. So
Yes.
it's yeah, very very dangerous when the heart is attacked. All right.
Mhm.
And you mentioned also that people think, okay, pumping blood, what's the big deal? Well, pumping blood means blood is carrying oxygen to every organ of your body. Oxygen is the building block for energy production. So no oxygen, that's it. So this can be very, very dangerous, as many of us know.
Yeah.
Now, and these talks are not done to scare people. They're not done to say, oh my God, maybe I'm having a heart attack. It's what can I do? How can I be empowered so I avoid things like this? And that's essentially where we're having this talk. So don't be afraid. That's not the agenda of this. It's just to get more information on how you could do better, even for your heart. All right, Doc. So, what are the top five um, causes you see? What are the top five causes of heart attacks?
Okay. So heart attacks, you know, multiple causes. In terms of risk factors, because people have different risks that they're involved in that could increase their risk of a heart attack. So we're just going to
Right.
address some of those risk factors in this place. So the major one, especially causing heart attacks in the young, is smoking. That's the biggest one. Smoking. Diabetes mellitus, high blood pressure. When it runs in a family, when other people in the family have had it, you have an increased risk of having it also. You know, and then if your cholesterol is uncontrolled, most of these things are, they're the modifiable risk factors and they're the non-modifiable risk factors. They're things you can make a
Mm-hmm.
change about. They're things that you can't do anything about. You can't change your genes. So if it comes to your family, you have that. You just have to make sure you aggressively address the modifiable risk factors. So diabetes, high blood pressure, hyperlipidemia, smoking. You don't want to smoke. You want to make sure you quit if you're smoking. A sedentary lifestyle. Get up, exercise, do those things that you need to do. So those are the things that we try to work to address. There are a lot of other risk factors. Drug use and other things like that also happen. But the most common are these ones I'm talking about.
Okay. So you mentioned smoking. So there are things that are modifiable, things that can be fixed, and there's some things that are, um, uh, of course, you can't go back and undo what family you were born to. So if you have a lot
Mhm.
of family members who have had heart attacks, there might be a slightly increased risk. But
Mhm.
you're not your genes completely, 100%. There's
Yes.
some things that can actually, it may mean that you have to work a little bit harder to prevent these things, but it's still also possible. You already answered the next question when we talked about can it be prevented, right? Can heart attacks be prevented? You mentioned if you smoking is a risk factor. So if you smoke, make an appointment with your doctor or look for other. And the whole goal of that is to, help you with quitting smoking because there are medications that can help with quitting. I actually had a patient who quit smoking by putting the cigarettes in the freezer and they had to thaw it each time before they could smoke.
I like the
And the
idea.
thawing was such a deterrent that they quit. And so I've been using that to tell people, so if you smoke and you can try that. It's not scientifically based, but I've had a few patients do that and it worked. But smoking is something that you could do to prevent it. Um, Now let's focus on the one. Let's say family history. You've had quite a few patients who come and say, "My sister had a heart attack." The parents, many people have had heart disease. How would you say they can prevent it? What would you say to that person who is watching and who's concerned about that?
Okay. So I'll say the first thing is, like you pointed out, you are not your genes. So you are not your parents, you're not your uncles, your aunts, whoever's had it. We all have a role to play in what happens in our future. So the fact that it happens in our family doesn't mean that, oh, well, let's just resign ourselves to fate. That's what's going to happen to us. We have a lot that we could do to make a difference. So
Mm-hmm.
what we do is, what we explain to our patients when this happens is, okay, look, you okay, those risk factors you have. Some of it is non-modifiable, but let's address the modifiable ones. So if we're coming in and then you smoke, that's the first thing we need to do. So we need to aggressively work on quitting smoking. I mean, before some people quit, cold turkey, one day it's over. Some people would have to
Mm.
go a step-by-step process to quit.
Right.
Some would have to say, look, okay, look, I'm gonna not smoke from a pack a day. I'll do half a pack a day, and that might
Okay.
do that for a few weeks and then go less, and then some people might have to do that. And then together we work together to achieve it. And at your pace, but understanding that there is, this is time bound. This is important to be done quickly.
Mm.
Some people, are diabetic, but they just don't care about their diet. I'm sorry.
That's true.
Um, yeah, don't care about their diet. So you need to work aggressively towards trying to make those changes. I mean, we know that the healthier your diet, the better it is controlling all your other risk factors, your blood pressure, your blood sugar, your cholesterol. All of that is going to be significantly based on your diet. So you definitely want to try to eat more of a, we talk about the DASH diet, which is which is more of a diet that has less red meat and less of but more vegetable based. Ideally, if you could go to a plant based diet, that's also much better. The Mediterranean diet is a great diet. Also,
Mhm.
more data shows that that is better for compliance. But just trying to actively change what we eat. It's not really to a large extent on some dietary fads, but it's like figuring out, okay, what are the contents of what I eat, and then what should I eat better.
Mm.
And the closer to a plant-based diet it is, the better it is. And then, with all that being said, then you have to comply with your medications. So there's no point in being diabetic and being on diabetic medications and not taking them. Or you take it and then you don't check your blood sugar, you don't follow up, and you don't see what's going on. You don't check your blood pressure to monitor if you're hypertensive, because you want to make sure that while you're treating yourself, you're being treated to a goal. So we recommend our patients have a blood pressure machine at home to check their blood pressure regularly, write it down, document that, check your blood sugar regularly, check your weight regularly, have clear goals and work towards those goals. And then once you're working towards those goals, then you're basically, changing the trajectory of what your genes were leading you to. So that's supposed to be the idea.
Awesome. Awesome. So
And
wherever you
sorry, most important thing I didn't say is exercise. I didn't mention that. Yes. So, we definitely want to get up and exercise. The American Heart Association recommends 150 minutes of exercise a week of moderate intensity exercise for cardiovascular health, which could be 30 minutes a day, 5 days a week, or however you choose to break it down. But you definitely want to make sure you're doing, moderate intensity activity, which could be running, could be doing cardio, it could be dancing, could be doing whatever you want to do. But get up and do
Mm.
something, because that definitely helps and it's very important. And for many people, that's really what their major risk factor too is, because it makes them get into the cycle of obesity. And then it's a bad cycle because you don't exercise, you get bigger, you get obese, your knees get bad. Then because you're not walking, your knees get bad, you hurt yourself because of size, then you can't walk. Then everything now just becomes a bigger cycle. Diabetes gets worse, and then cholesterol
Mm.
gets worse, and then
Mm.
that cycle continues. But if we started in the early phases of exercising, we don't start that downward spiral.
Awesome. So one of the biggest things you could do as a preventive measure is to exercise. You mentioned diet. Essentially, all the diets he mentioned, more plant-based is good. So more plants to your plate. We did a live not that long ago, how to get more plants from your plate and into your mouth. We're going to do another one later this month, but it's really, really important. I didn't ask him to say this. These are tied to many, many diseases. And think of eating fruits and vegetables and more of a plant-based diet as helping you to unclog the pipes in your heart.
Mhm.
Just think of it that way, because we're talking, the analogy is plumbing. So really, really important. Thank you, Doc. Now, the next question I have is this, and I wanted to highlight this as something that people should pay attention to, and that is stress as a risk factor for heart disease. What would you say? What would you say to that? The relation between stress and heart attacks.
Yeah. So stress is a risk factor for heart attacks. It's interesting when I talk to my patients and I'm like, okay, well, stress is your risk factor. You need to be concerned about, trying to address that. And they're like, we all stressed. I'm like, yeah, I know. You're stressed. I'm stressed. We all have stress. It's like, how do we deal with the stress? You know,
Hmm.
what are our coping mechanisms? Because for every one of us, we have to have clear coping mechanisms. Everything needs a break. You can't drive your car every minute of every day. You can't do anything without, having a pause. So what are our coping mechanisms with stress? If your coping mechanism is, prayer, religion or whatever, you want to make sure that you're addressing that. If your coping mechanism is just taking time off, and spending time with family and people you love, but you have to have a de-stress. You have to have if it's exercise, if it's whatever it is, have a clear de-stress button. And where, we know that people who have type A personalities are more likely to have heart attacks. It doesn't mean if you have a type A personality, you are going to have it. It means that you have to make sure you have an outlet. So working on making sure that those outlets are dealt with. Unfortunately, stress, we do have a lot of patients who come in with stress-induced heart attacks, okay, which we call, broken heart syndrome, okay. I have, unfortunately, affects more women than men. But it's one of those things where you have a younger person who is probably, at any age, but, you have somebody in their 40s, and then they hear some bad news or some going through a lot of emotional stress, and they have chest pains, and they come into the hospital. And then in the hospital, the emergency room, even before getting to the emergency room, the EMS guys see them and say, look, oh, your EKG shows you're having a heart attack. We're getting to the emergency room right now. They're calling me, they're sending me the EKG. It's a heart attack. We're getting the team ready. We're running into the hospital, everybody coming from their houses because we have to go in and fix it quickly. But when we go in there, we find out that it's not because of an exact blockage in the artery. It's because that heart attack happened because of stress. And so the catecholamine surge and everything happened, and then the heart gets weak. And then they have, everything else that happened in the heart attack, but it was all because of stress, emotional stress. And then, so we want to make sure that we don't have, we address all those things properly. But so exercise, outlets, whatever things that we have, we just need to make sure that we work on those things to try to ameliorate stress as much as possible.
Awesome. Good to note. Self-care is very, very important as a de-stressor. And so a stressful lifestyle can also increase the risk for heart attacks. Now, Doc, people are maybe curious, how do you fix heart attacks? So people hear about, having a stent, so in ways, in simple terms, how would you explain how you fix a heart attack?
Okay. So, I use the word fix a few times, but I know it's not fixed permanently, because whatever we do gets it better and then helps resolve the issue that is currently going on. But I don't want patients to think of, oh yeah, anything can be fixed. I'm just going to fix it and then I get back to my normal lifestyle. There are consequences, there are damages, there are things that happen long term. And then, so having that in mind, what do we do when a patient has a heart attack? So I'll give you the typical story. The typical story is, for some reason it happens late at night. It happens any time of the day, but we remember the ones that happen late at night. So at night, somebody has chest pain, they wake up. So sometimes it's chest pain. Sometimes it's very typical chest pain. And this is very important. Not everybody has typical chest pain. Some people will have jaw pain. Some would have pain going on the arms. Some will have a discomfort. Some will feel like I can't breathe. Some would feel like, okay, they have a different presentation, especially in women. Women will mostly have chest pain. Everybody will mostly have chest pain, but people could have different presentations where it just doesn't feel like, oh, it's my heart, but then I feel something. Okay, take it seriously. Call EMS. Get into the hospital as soon as possible. Don't try to drive yourself. Get someone to get you to the hospital. Most likely the emergency medical services. And then they come into the hospital, and then once we confirm that it's a heart attack, what we do at that point is that we would either go through the wrist or through the artery and the femoral artery in the groin. Okay, it's a big artery that goes down the legs. So what we do is we go with basically like getting an IVA. So what I would typically do is put a bigger sheet into the radial artery, which is where I do most of my heart attacks. In the past, we used to do everything through the groin, but things have evolved to the point that some of us do most of our cases through the wrist. So we go through the wrist. We prep the groin, obviously, to be sure. We go in with some tubes, and then with those tubes, we go through the wrist up into the aorta, and then through the aorta, we're taking pictures, injecting contrast into the left side of the left coronary arteries and then the right coronary arteries. We're looking for major blockages that one has. If you have a major blockage that requires fixing, then or if you have 100% blockage, which is typically what happens in a heart attack, then we put a wire down that artery, and then we balloon it. We put an ultrasound down the artery, image it, and based on that, we decide on the stents, and then we optimize the stent however we need to do that. Hopefully, when you have a heart attack, most of the time we will fix that with stents if it's a bad heart attack that needs urgent intervention. Some people have extensive disease everywhere where we think that, look, this is not something to deal with a stent. It needs an open heart surgery. At that point, we would take a step back and say, look, we'll deal with whatever needs to be done with now, and then take a step back and then discuss open heart surgery. But for most cases, we will deal with it with stents, and then for most cases, we are able to get the patient stable off the table in before an hour they're done typically from the procedure, and then an hour, at least over an hour, and then they feel better, keep them in the hospital for a few days to monitor them, and then get them home.
Wow. You dropped a lot of gems. You talked about, well, now there are better interventions where you don't have to go through the groin, which is good. But you also mentioned that it's not necessarily a fix. It's to help you get better. All right. So prevention is very, very important, but there are options for those who have, of course, who are having a heart attack to make sure that they still live good quality of lives. And essentially what you're going to do is to try to open up some of the blockages or release some of the blockages by placing a stent. Now, if someone is listening here and saying, well, doc, I'm happy that we're talking prevention. We're talking, I should watch my diet. I should watch what I eat. I should exercise. But this person already had a heart attack and they're afraid of having another one. What would you say to them? And I'm asking this question more to balance the concern of having another one with, the fact that it is still possible to live a good quality of life even having had a heart attack, right? What would you say to that person who's watching?
I would say, hey, a lot has changed. Technological advancements have gone on. We have a lot on our plates to live good quality lives. I mean, I had a patient I remember who had a heart transplant like 10 years before. And he's still so he's had heart attacks, he's had major issues, had heart transplants, 10 years ago, he's still living a good quality of life, he's still working, he's still productive. I mean, some of them 20 years later, still doing. So you could leave, none of this is a death sentence. It's all about, okay, look, now let's get back to the drawing board. Medications, we're going to comply with that. We set them to cardiac rehabilitation. They go into the hospital, they do some exercise, they do cardiac rehabilitation. You try to change what got you here. We can't keep doing the same things that we did to get and then expect different results. So then you have to make changes and all that, because when you deal with the worst artery that caused the heart attack, it's like pipes. They're still clogged in other places. So it's not like we go and then we're kicking off everything. It doesn't work that way. So you still build up that could happen in other places. So that's why I don't want us to see it as a fix. I want to see it as, okay, look, yes, the fix is what we do. The fix is going on our plant-based diet. The fix is what we do in terms of going on a exercise regimen and all of that, which is the thing. I don't want to use that word fix anymore, but the things that we need to do to try to improve. But that's the idea. And then, we have a lot of patients who get back to living good lives, get back to running marathons, get back to doing whatever they want to do. It's not the end of the road. It is just, a bump that helps to redirect us and help us get where we want to go.
Awesome. It's a bump in the road on the journey to where we're supposed to be. But I want to encourage everyone who's watching, and thank you so much, Dr. Bolorunduro, for coming to enlighten us about heart attacks. And, as scary as it sounds, it's preventable. It's preventable. Got to manage stress, smoking. If you smoke, find help, get help stopping, exercise, preventive, and even after having a heart attack. He did mention cardiac rehab. That's exercise that's geared with exercise that's tailored to the person who has had something wrong with their heart and to make sure that there's a good balance of how much exercise they do. So talk to your doctor about this. And of course, all our conversations today are suggestions. It's important to have an individualized consultation with your doctor on what's best for you. And these conversations are had to help you, like we talked earlier, live better quality of lives now and in the future. Dr. Bolorunduro, thank you so much for having or for coming on the show
You.
today. I know that you're a busy guy and Saturday morning you have other things to do, but thank you for gracing us with your presence.
Thank you
For
for the
those who are
opportunity.
wondering, they're like, Doctor, I want to meet with this cardiologist. Where is he? How can I find him? How can I connect with him? What would you say? Where can we find you, Doc?
Okay, so um, we work at INOVA Cardiovascular Care, so NOVA Cardiovascular Care, which is Northern Virginia Cardiovascular Care. So we're in the DC area. We have offices in Woodbridge, Stafford. We work out of INOVA Fairfax,
Okay.
Sentara, Northern Virginia, and then Mary Washington Hospital Systems. So basically, a few minutes from DC. Yeah.
All right, awesome. So when we're done, I'll put that information for those who want to connect with you after the
Mhm.
show. I'll make sure they have a way to reach out to you. Okay. Thank you again. And thank you all for watching. Those who watch live and in replay, please share this with someone who could find this useful. We'll do this with you in mind. And if you or anyone you know is looking for an awesome, thorough, and passionate family physician here in the Mansfield, Texas area, I am she. Thank you.
Thank you very much. Take care. It's great for the thanks for the privilege.
My pleasure.